Sitting down with Dr. David Klein once again of the Stages of Life Institute, and today we want to talk about something that better make you sit up in your chair, and that is heart attacks and strokes. And you know, doctor, it seems like, especially in Central Florida where you and I live and the people are a little bit more aged, it's not a day goes by that somebody doesn't say to you, hey, did you hear that John had a heart attack? No, Jim had a stroke. I mean, it's prevalent.
Yeah, it's kind of like the feeling that you have if we were in, let's say, in the trenches in the First World War, okay? And you're sitting there with all your buddies waiting for that whistle to be blown, so you go over the top and you get picked off by the other side. There's no getting out of this, okay? It's going to get one of us. It's going to get all of us. The question is when. How long are you going to hang around, okay? And that's really what it's all about. We are all going to go at some point. It's how you go that really concerns me. I'm not so sure that I want to go by not taking care of my health at a time when I can, by not doing what I can to prevent what may well be a life-threatening illness, or even worse than that, a limb-threatening illness that leaves you alive. So here you are. You have a massive stroke and you drop over dead. You're not going to worry too much about it. Okay, Rockefeller went. His kin worried more about the secretary than he did because he was gone. Okay, good for him. All right, but it's when you're crippled that is a real concern. You end up with a stroke. Great example of a problem that is preventable. Now you can't speak very, very clearly. You can't move your arms the way you thought you should. And they take away your driver's license for some period of time because they're afraid that you're going to go careening down the road in a 2-ton vehicle at 60 or 70 miles an hour and take out a school bus. So you really have to be aware that these things happen and it can be impactful on your life and impactful on the life of others. There are two pilots in commercial aircraft in case one of them has a heart attack or stroke. Okay, that's really what the reality of the situation is. So what do we do? For starters, what is a heart attack? Okay, a heart attack is an interesting event, okay, where the blood supply to a portion of the heart or all of the heart is cut off all at one time. Okay, it could happen gradually, but very, very typically the heart attack, as opposed to angina, is where a little piece of thrombus flips off. Okay, and it blocks an arteriole, that's a small artery, feeding a portion of the heart, usually the front of the heart, and then that heart tissue starts to die off. It's like having gangrene ensue. If you cut off tissue to your finger, let's say that you went ahead and wrapped a tourniquet around your finger, it'll turn purple and eventually it'll die. The tissue dies and it's irreversible. That's what happens with a heart attack. So the arterioles start to narrow. They start to get smaller and smaller and smaller. Why does this occur? Typically, it's because of something called plaque. Not the plaque on your teeth, but the plaque on the inner aspect of the arteries. And this occurs as a result of inflammation. The platelets go banging around through the inner aspect of your arterioles. They hit these little bifurcations. These are areas of the artery that start to divide into two. This is where turbulent flow occurs. It's almost like an intersection for your car. Most accidents occur at intersections. Well, that's what happens here. It causes inflammation at that intersection, and then wouldn't you know it, the platelets start to see the inflammation, start to slap down to act like little Band-Aids, and then cholesterol deposits will follow. So we think cholesterol is the problem. Well, you have too much cholesterol. That's what caused the atheroma, when in fact it was the inflammation that did it. How do we deal with the inflammation to prevent the heart attack? That is what we're going to discuss. What about stroke? What's that all about? Well, that's when you end up with a small piece of junk, okay, and it could be a clot, it could be fat, it could be air, it could be a lot of different things that passes down from the vein, lower extremities more typically, to the heart, and then from the heart either to the lung or to the brain, okay? It goes to the lung most typically because the brain is protected. There are two sets of circulation. If you have a hole in the heart, which a certain percent of people do, it can pass from one side to the other, and then you end up with a stroke from a lower extremity clot. Preventable illness. Why does this occur? Again, it gets back to inflammation, but more times than not from immobility. So we will see a high incidence of blood clots in the legs when you fly on airplanes. Okay, by being immobile for as little as an hour, okay, it's going to increase the likelihood of small clot formation in your legs. Then what do? What's the next thing you do? You get up and run through the airport, going to pick up your next flight or whatever you're going to do, and then more times than not, these little clots break loose and they end up in your lungs. Wouldn't you know it? Okay, it's extraordinarily common, and you wouldn't even know that it happened, because that's the function of the lungs. The function of the lung is to act as a filter. It's not a big problem throwing these clots to the lungs as long as it doesn't include large amounts of the blood flow to the lungs. A saddle embolism is a very fast way to go. I mean, it hits that area and you're dead before you know it. You drop over, it's done. But more times than not, you develop something that looks a little bit like walking pneumonia. It might look a little bit like a cold. It might look a little bit like, heartburn. And what's happened is you've thrown a clot. It goes to the lung. It causes some pain, but it clears in a day or two. Okay, so what do we do to prevent these things, and what do we do to treat them? And better, what do you keep around your house that may save your happy butt in the event that you develop one of these nifty little clots? Well, one of the things that's easiest is to keep aspirin. What is aspirin? Now, we're not talking Tylenol, we're not talking Motrin, we're not talking Aleve, we're talking aspirin. Okay, it is what it is. There are no substitutes for it. Aspirin is a platelet aggregation inhibitor. What does that mean? It means it thins your blood a little bit. It may save your life in the event you start developing a heart attack. So they'll tell you, in the event of a heart attack, take at least a baby aspirin. For me, I'll take half a jar. I mean, I'll be taking the full 325s, and I'll take 2 of them 4 times a day, just in case your body needs a little bit more. Why? Because that anticoagulant effect is terribly important. To the effect, that I take a baby aspirin every night before I go to bed. Why do I do that? Because that reduces the risk of heart attack and stroke by 15%. The number of people that don't do this simple this simple procedure is mind-boggling. That the technology has been out there for decades. The knowledge has been out there for decades. I put my parents on this back in the 1970s. They both lived into their 90s, and their parents didn't live much past their 60s. So they lived past their genetic likelihood by doing simple things. Aspirin being one of them. So you keep aspirin in your medicine chest, and if you're smart, you'll take a baby aspirin every night on top of that. Preventing heart attack and stroke by taking fish oil. Now, there's a big argument out there. The argument is one of those sorts of things where traditional medicine doesn't necessarily look at fish oil as being particularly effective, when in fact, traditionally, we've known it's been effective for centuries, and wouldn't you know it, if you got the prescription fish oil, it works. Now, last time I checked, we did not need to have prescription oxygen. We didn't need to have prescription water. We don't need prescription cheeseburgers, for God's sake, to survive. But you need to have prescription fish oil, otherwise the real stuff doesn't work. Where in nature does the artificial work better than the real? So you take a good fish oil. What's a good fish oil? It's something that's been distilled 5 or 6 times. It takes the stink out of it if it bothers you, but it also takes a lot of the calories out. So you're getting the EPA and DHA without the heavy calorie load. What about keeping this around in case you have a stroke? What can you keep at your house that may give you some relief should you be waiting for that ambulance to show up? Something called bromelain. Bromelain is a proteolytic enzyme very, very similar to the stuff that you get in the hospital intravenously when you have a stroke. A bottle of bromelain at your home with instructions how to take it in the event that you're incapacitated could be very, very important to you. Bromelain will, in fact, dissolve away these clots. If you have, clotting in your legs, this stuff is very, very helpful to clear it. So there's simple, very, very simple things that you can do to save your life. There are very, very simple things that you can do to save your spouse's life. Things that you can do to minimize the trauma after the event. So what do you do if you've had a stroke? There's a critical time with which you should be treated. Let's assume that you made it to the hospital. They gave you the intravenous peptidases. They're done. What can you do to regrow your brain matter? And it can be done. 2 things. One, you want to be taking that fish oil because there's something in it called DHA, and then you take additional DHA on top of it. Why? Because the brain is largely made up of DHA. Wouldn't you know it? So when you want to regrow the tissue or get it healthier again, you give it the raw materials that are necessary for this to occur. So I typically start people on fish oil, 1.5 grams to 2 grams a day, sometimes a little bit more, and DHA, 500 milligrams 3 to 4 times per day. Progesterone, oddly enough, will promote regrowth of the brain tissue in men and women. It's not a chick hormone. It's for both men and women. The dosage may be a little bit different. If you know how to handle it, it's pretty simple and straightforward. High-dose folic acid reverses the plaquing in the small vessels, the small arteries. This is terribly important to increase collateral flow and to restore function to tissues that have, let's say, marginal function. Okay, you can see return very, very quickly with this. Then we're starting to look at other sorts of things like alpha-lipoic acid, very, very helpful, acetyl L-carnitine. These are naturally occurring substances that you can buy in a bottle. They will give you the return of function that you're looking for, something that you should be doing, something that needs to be in your possession.
All right, doctor, now that we've talked about heart attacks and strokes, let's talk about joint replacement.
Well, here is the interesting thing about joint replacement. And it's the thing you're not necessarily going to hear, but it's one thing that drives orthopedic surgeons crazy because this is their bread and butter. Everybody is going to hear, gee, we think that you're going to need to have your knees replaced because after all, it's quote-unquote bone on bone. And that sounds awful when you think about it, doesn't it? Okay, it sounds like you ought to be just limping in misery, but in fact, you've been walking around pretty much just fine, but your knee hurts a little bit. Bone on bone is not a reason to do anything. It simply means that the cartilage is worn away. Cartilage does wear away, but it doesn't necessarily mean you have to do anything. What's more is it doesn't necessarily imply that it's causing the pain to begin with. Because what? Why would that be? Why would it not be that bone on bone is causing pain? It's because the pain fibers that surround the bone actually are in the membrane called the periosteum. Okay, and guess what? All that wore away. Okay, so really the bone on bone is not causing any pain at all. Okay, the periosteum is elsewhere. It's in the intact portion of the bone. But what will cause pain in a joint like that is inflammation from the, let's say, the particles, the debris, the garbage that's thrown into the joint. It causes an inflammatory response in the bursa surrounding the joint. This is a lubricating sac. Okay, it causes a bursitis and an arthritis, but not necessarily as a result of bone on bone. So what do? They go ahead and they start cutting away at living tissue, replace it with a piece of surgical steel, a couple pieces of Teflon, okay, and if you wake up after that, good for you. The problem is that every time you go in for joint replacement, you're rolling the dice. Everybody likes a winner. Nobody likes a loser. Okay, but a significant number of people that go in for joint replacement end up with problems that they really didn't bargain for. My favorite one is something called reflex sympathetic dystrophy, or CRPS. When you're doing like a knee, for example, you're putting a tourniquet in the upper thigh, two of them actually. That's one big tourniquet made up of two, and you're inflating it to 450 torr. Maybe more. Now, what's your blood pressure run? About 130 to 150. This is 450, and it keeps you from bleeding to death when they do the surgery. It's called a tourniquet. But underneath that tourniquet is something odd called the saphenous nerve. You can clip the saphenous nerve right at the border of this tourniquet, and it can cause lifelong pain. A lot of failed knees actually aren't the joint going bad, but it's the nerve being clipped. I've seen a lot of patients over the past 30 years that have had persistent joint pain of the knee following a single knee replacement or several knee replacements, which they keep redoing because they can't figure out why the joint hurts. It's sickening, if nothing else. Now, what's the first thing that you want to do if you have a joint that's gone bad? More times than not, losing weight, for God's sake. When I was at Duke, we wouldn't replace people's knees if they were overweight. Why? Because if you did replace the knee and you only knew that it was going to last 5 to 10 years and that was going to be accelerated if they were heavy, nobody wanted their name on the op note for that individual where the knee failed. So the first thing we would do would be to have people lose weight, and we would do whatever it took to get them to lose weight. The same thing is true of hips. Hip replacement, same thing. It's bone on bone. That doesn't explain the fact that you were not limping 3 weeks ago and now you are. You think the bone worked its way through over the past 3 weeks? No, inevitably it's something else where physical diagnosis was missed, and more times than not, somebody is looking for an excuse to put their kid through college. You do not want to be that excuse. But failed joint surgery is a big deal. How do they fail? They fail because of either complications involving the nerve, but my favorite ones are infection. When these joints they get infected, it is a disaster. Depending upon where you are, you may or may not have increasing difficulty finding a surgeon to replace an infected joint. Okay, so the first guy says, well, I don't do infected joints. I'm going to refer you out. Nobody's going to want to touch you. From the university straight on down, nobody with any brains is going to want to touch an infected joint like that. That has somebody else's name on the replacement. That's a no-win situation for the doc, but it's an always-lose situation for you. Now, let's say that you've made the decision to have your joint replaced. Well, good for you. Okay, you've had the joint replaced. Maybe good for you. What can you do to harden the bone? Which, by the way, was the problem to begin with. Why did the darn things, why'd they wear away? It's because you had no estrogen on board. Okay, women, osteoporosis results from that. With men, it's typically because their testosterone's too low and the bone wears away as a result of that. But you can go through, get the hormones replaced. If it's testosterone, it's very, very easy. If it's estrogen and progesterone, it's a little bit trickier, but it's no big deal. And harden the bone. By getting the hormonal balance in place before you do the surgery, you have a much better chance of doing well. And post-surgically, you need to do it in order to heal the darn thing anyway. But what else? There's a mineral called strontium. Now, we got people out there, well, they told me to take calcium. Well, good. Why didn't they tell you to take calcium 15 years ago? It wouldn't have made any difference, but at least they would have been consistent. Now that you've got this damage, they're going ahead and making a recommendation after the fact. It makes absolutely no sense at all. So strontium is the chemical. It is the mineral. It is the agent that acts like rebar to cement. It holds everything together. So the first thing that I do is I have people pick up a chelated strontium. The chemical would be strontium citrate. Dosage is 200 milligrams, 2, 3, maybe 4 times a day. That will make the calcium stay in matrix. Calcium hydroxyapatite is the calcium that you want, not this calcium carbonate, calcium oxide junk that most people pick up. And then vitamin K2 and vitamin D3. So it's strontium, calcium hydroxyapatite, vitamin K2, vitamin D3. This will help you harden the bone. That is what you must do, and you probably should be doing now. If your friends are getting joint replacements, odds are you're at risk too. Why? Because we don't hang out with teenagers typically, okay? So people in your age cadre are going through the same problems that you're going to go through. So take the advice I just gave you, do it. I do it. I invite you to do the same.
Some of the pastimes that are really enjoyed by the 50-plus crowd, one of them is golf. Golf has got to put a lot of pressure on even the healthiest knees and hips.
Okay. Ryan, one of my patients is an extremely well-known golf pro.
Yes, sir.
Okay. Pro teacher's really what he does. He's got a little deal going out west of Orlando. And I asked him, I said, maybe I should learn how to play golf. And his response is, hell no, are you crazy? In any event, if you have already been bitten by the bug, golf is a very, very stressful game. Okay, people think that it's just walking along through a field, but it's not so. What you're doing is asymmetrically loading your joints, loading your lower back, loading your shoulders, and doing what may be the world's most unnatural physical act in any sport that there is. Mm-hmm. So it tears up the hip, typically the non-dominant hip. So if your right hand's the left hip that takes a beating, it would be the left elbow, the right shoulder, the left neck. Why? Because when you're there doing a drive, okay, this is where the damage occurs. Where else are you going to get hurt? Well, we're going to ignore the odd alligator. So you go after a ball. If the ball goes in the water, leave it alone, okay? Don't go after it. Leave that for the tourists. They call them righty. Why? Because he lost his left hand going for a ball and there. Alligator bite. Brilliant. So the drive is what gets most people. Sand trap gets the rest. Why? Because when they're in there and they hit that sand, it jolts their whole system. You do not need to be doing this, or if you are doing it, be very, very careful. One last thing is on your golf shoes, see what you can do to file off those cleats. Okay, why? Because the cleats tear up the lower back. If you have to have a cleat to keep your feet planted, you're going to do damage to your lower back, because you would far rather have your heel slip and save your back than have it planted in the earth and then tear the torque in your lower back. It's easier to heal the ground than it is to heal your lower back.
And we've talked about in other shows the importance in senior fitness of stretching a bit before you even go out there and try to do this. But we've also talked about the therapeutic swimming. And Lord knows these communities up here have a lot of swimming pools. So best run around in the pool.
Do the best that you can. You are blessed with having facilities. You're blessed with having time to do it. And you are blessed with having Florida weather. But there are things that you need to do to protect your joints. There are things that you need to do to prevent the inevitable illnesses, injuries, and whatnot. But vitamin K2, vitamin D3, strontium, Very, very important for this.
And
Hormone
fish oil.
And fish oil, of course.
All right. And where would I find those things? I want to know exact shelf location at the stages of life. Where do I go?
I don't think I can tell you the shelf locations. But anyway, we do have people in the health store that will help you find everything. So do come on in. Give us a call at 407-679-3337. Office hours are Monday through Thursday, 8 to 5. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. Our website is stagesoflife.net, and we're also on Facebook at Stages of Life Medical Institute.